Welcome to the Oral Health Podcast. We are back for National Smile Month 2022, and over the next few weeks we will be having bite-sized discussions with different people from all walks of life about a variety of things, because this year our theme for National Smile Month is Everyone Deserves a Healthy Smile. Today, I have been joined by Anita, who is an oral health care lead in the hospital service, but has a lot of experience as a dental nurse and in dental practices as well. So she's going to give me a little bit of a rundown about her average day, if there is one, and give me a little bit of an insight as to what it's like being an oral health care practitioner in the hospital service, dealing with people that may have very severe needs. I hope you enjoy my conversation with Anita as much as I did. So, Anita, thank you so much for joining me. How are you?
Yeah, really good actually. Yeah, busy, very busy, but enjoying life.
Good. Well, that's the main thing. So, Anita, thanks again for joining me. So, we're interviewing you as part of our dental series for National Smile Month, where we're showcasing lots of different types of roles within the dental team. So, I'm really looking forward to talking to you and learning a little bit more about what you do.
Well, I have a slightly unusual role, and I don't work with a dentist, and I don't do any dental nursing. So, I'm an oral health improvement practitioner.
Okay, and what does that involve then?
So basically, you'll have heard of Mouth Care Matters. It started off as Mouth Care Matters, and I'm employed by a hospital trust to look after the oral health of our inpatients.
Okay.
So it's a very, very interesting job. I had to work hard to get there, but I've been there for 5 years now, and I was redeployed during COVID, unfortunately, but I have a really fascinating job, and it's a really, really worthwhile job.
Mm-hmm.
And I'm not part of a dental team, but I'm part of a wider team, and I sit with speech and language therapy now. I was placed with that team because the speech and language therapists can't do their job if the patient's mouth isn't clean and healthy. So mostly it's about dysphagia, so where people can't swallow after illness or surgery. The speech and language therapists need to assess their swallow. Now, if the patient's swallow isn't safe and they're not swallowing properly, whatever they put in their mouth will go down into the lungs. So they'll aspirate food and fluids into their lungs, and then they'll get pneumonia. So it's about the speech and language therapist being able to assess whether the patient is safe to go on to solid food and drink. And they cannot do that if the mouth isn't clean. So it's my job to make sure the patient's in a good state of oral health. But I get a lot of referrals, and it's not just to do with speech and language therapy. It's to do with patients who get toothache while they're in hospital, or they have very dry mouth, or they have bleeding in their mouth, something that the nursing staff aren't entirely clear on. So they will ask me for advice.
So then what does oral health care look like for someone that's an inpatient in a hospital? Because if you're in hospital for a really long time, you're not going to be able to get out to go and visit the dentist and do all the community things that would otherwise be available.
It's very difficult for them, because we know from research that when people go into hospital, their oral health goes into a steep decline, and that can be for a variety of reasons. So it's usually the fact that they're on loads and loads of medications, which leads to dry mouth. It can be that they're not able to do their usual oral hygiene routine because they haven't got their brushes with them, and they haven't got their toothpaste, or they can't get out of bed, or they're very poorly and they're not engaging with it. They're not engaging with their usual hygiene routines.
Mm-hmm.
It's about assessing, the nurse is assessing the patient's level of dependence for personal care. So they have to know if the patient can get up and go to the bathroom, and they've got a toothbrush, and they can go and clean their teeth and take their dentures out and so on. In the middle, you've got patients who need a bit of help. So it might be giving them the toothbrush in their hand, or it might be reminding them that they need to brush their teeth, or bringing them a bowl to spit into, any of those little things. can be the difference between the patient being able to maintain their oral hygiene and not. And then finally, you've got lots of our patients who are very poorly and are totally dependent on the staff to do their oral hygiene for them, take their denture out, clean it, that kind of thing. We've got patients who are on hourly mouth care because their mouths are so dry and unpleasant. So it's about training the staff in the hospital to do these actions properly, and also about providing good equipment for them to do it. So, and then we've got end of life patients, and then it's about comfort for them. So just maintaining their mouth so that they can be comfortable. So it's very wide ranging.
It definitely sounds like it. So it does also sound like 2 days would never be the same then in your job.
No, absolutely not. So I can be teaching. So I tend to be asked to teach on various study days. So I'll have a session to talk to staff on end of life study day, stroke study day, that kind of thing, patient safety study days, student nurse study days is my next one. So it's about putting the mouth back into the body, to coin a often used phrase, and that that the staff understand that you have to think mouth. Or quite often in the past, when patients have stopped eating or they've stopped talking or they've neglected with their therapies and they're not engaging, staff don't automatically think about the mouth, and they don't automatically look in the mouth to see if there might be a dental or oral health cause of this. So it's about awareness. A lot of it is about raising awareness.
And how have you found that then? How mouth aware do you generally find that hospital staff are? When it comes to things like checking inside the mouth and looking for symptoms of dry mouth and other oral health conditions.
They're getting better, but generally speaking, not very. There's been a lot of talking about putting the mouth back into the body. And I'm finding there's a little bit more awareness, but doctors have said to me, we aren't taught how to look in the mouth. We need you, we need you on the wards. So that's quite gratifying. And if I talk to medical staff, they're always really interested, and there are things they don't know. So if I'm walking down the corridor at work, someone might shout, "Spit not rinse." It's happened several times. Or, "Anita, I've had no fillings." So it's all about raising the awareness of the importance of oral health.
Mm-hmm. Well, it just shows you as well that you really do play a key part on the wards, because if doctors are coming up to you and telling you, "We don't know how to do this, we need you," it just shows how important you are to that patient and their comfort.
It's a very worthwhile job. I'm very lucky to have this job. Actually, it's a privilege.
It sounds like it would be really worthwhile.
It's very satisfying to do that. My favourite thing is when maybe I'll go and see a patient who's very poorly before their discharge, and I'll demonstrate to their carers or their family how to look after the mouth. And they're really grateful for that and the opportunity to know how to do it properly. And just knowing that going forward, that patient is going to have a comfortable mouth is very satisfying to me.
And what would you say then is your favourite thing about your job at the moment?
That's my favourite thing. So my favourite thing is, there are two favourite things. I really love teaching and I love training the staff in oral health. And I like to see the surprise on their faces when I tell them something they didn't know. Some basic oral health message that they had no idea about, and that's quite nice. And I really like it when I can help a patient who hasn't been eating, hasn't been speaking, to actually be able to speak to their relatives when they come in to see them. Their mouths have been so dry and painful that they haven't wanted to eat, and then they start eating, and that's very satisfying to me to see the change in them. Simple oral health measures can make such a difference and completely change a patient's journey.
So then, how would you say that, because I know you've worked in practices before, how would you say what you do now compares to what you used to do in the dental practice?
Well, what I do now, I haven't got a big team around me. The team I do work with are very knowledgeable and very supportive, and they promote me, and so it's very good. I'm very comfortable in that team, but it's not the same as the dental team. So I haven't got a dentist to ask. We've got no dentist in my trust of any description, so I've got no dentist to ask if I don't know something. So that's quite difficult. We do have a network of Mouth Care Matters leads. So basically, when I did the Mouth Care Matters training in East Surrey Hospital, maybe 5-6 years ago now, those of us who trained together, we maintained our own network, and we are solo practitioners. So we do refer to each other a lot, and that really helps because we all have the same little struggles on a daily basis. So so it's really nice to have those people in my network. And if we're not sure of something, or we want to know how something is done in another trust, or have you seen a patient like this before, then we do share information and we support each other. So that's really good. But it is very different to a dental practice. The main difference being that in dental practice, you don't see very sick people, because they're well enough to come to the surgery. And the practice that I was in, we'd had the same patients for 30 years and their families. It was a very traditional family practice, and most of our patients had good oral health. They came in for maintenance, really, or if something broke, or if they wanted a new denture. But in the hospital, it's very, very different, and I see many patients who have neglected their mouth over the years. See people with broken teeth and bad gum disease and so on. I'm always recommending to the patients and their carers, when you're discharged, you really need to go and see the dentist. You really should go and see the dentist for a variety of reasons, but you really need to get a dentist to advise you on your mouth. And this, there's a bit of a barrier to overcome here, because many of our older patients are terrified of the dentist because they have bad childhood experiences. And many of them are afraid of the charges. They worry they won't be able to pay. So a lot of my job is kind of a dental cheerleader. I'm like, well, if you claim certain benefits, you'll be able to get free treatment. Dentistry has changed from when you were a child. You're very much in control now. You choose what treatments you want, and it's about putting it in their control, isn't it? Which it didn't used to be when they were children. It was out of their control. So very much reassuring them about dentistry in general, and promoting the good work that practices do.
Are there any patients that you've had that really stick out to you? If I was to say, can you give me an example of a patient where that you've made a difference to their quality of life or their dental care? What examples spring to mind?
Yeah, I've had a patient who came in from a care home in a terrible state of oral health, and his breath was so appalling that staff didn't want to open the curtain and go and see him and give him his personal care, and I was called in. His tongue was heavily coated and very unpleasant. His teeth were filthy, basically, and he dry mouth again. He was really struggling, and it was more about supporting him with his oral hygiene and showing him what to do and helping him. So I usually had a nurse with me to help me. The nurse was looking after him, just demonstrating, showing, and just helping him generally to improve his mouth. And towards the end of his stay in hospital, the one worry that he had was how will the staff where I'm going know how to do this? Will they help me? And his worry was about that. So it is about discharging the patient with a care pack for their mouth, and if necessary, calling up the care home and talking to the staff there. So it's just generally all around support, and that made a really big difference to that gentleman, and he was very, very grateful for the help he had. He knew his mouth was in a shocking state, but he was poorly and he didn't really know what to do about it. So that was great. I had another patient who came in who hadn't spoken for weeks to her husband. She couldn't speak. And her mouth was just so dry with thick, hard deposits of secretions on the tongue. And I gave mouth care very gently. She was quite frail. Gave really gentle mouth care over a few days because these things take time and you have to have frequency of dry mouth care. And she was eventually able to speak to her husband again. So that was pretty marvelous. She was still very sick, but she could communicate and she felt like communicating, which was really lovely. These are the things that I see on a regular basis, and some of it is heartbreaking, but some of it does have a happy ending.
That's really lovely to hear, and God, what a difference it must make to both of those people, mentally as well as physically.
Yeah, it's about comfort and about compassion and about dignity, and just making sure the patient has their dignity while they're in hospital.
Yeah. And then do you have any advice for anyone that maybe is thinking about going into dental nursing or dentistry in general?
Yeah.
What would you say to someone just getting started?
Have you got any advice then for anyone that is maybe thinking about going into dentistry or dental nursing? Do you have any advice that you want to pass on to anyone that might just be getting started on their career?
Yeah, I mean, I was in dental nursing for many years before my career developed in this direction. And I would say to anyone starting out in dental nursing, the best advice I was given was invest in your career. So if you want this to be a career, you have to invest time and maybe money and definitely effort and continue your education. So the advice I was given was to look to what your next step will be. What would you like to do next? How would you like to progress next? And what do you need for that to happen? And focus your attention on that. So that's where your personal development plan comes in really handy. Just focusing your mind. It's very easy to drift. Very easy to drift. Found that myself. So I'd had a lot of experience as a dental nurse, and I knew how to do that job, and I wanted to do something else, but I didn't quite know how to do it. So that was the best advice I've had, and that is what I usually pass on if anyone asks me. Oh, and your network. Always rely on a network. So spend time on your network and making a network for yourself. And you find that from attending various training and various education, different meetings, joining your professional association is really important. Just staying active within your profession, you will gain a network, and that is how opportunities will come your way.
Is there anything that surprised you when you went into dentistry, or when you made the leap from working in the practice to working in the hospital service?
It was the difference between patients I'd seen in practice and patients in the hospital. That was the biggest surprise to me. The second biggest surprise was that medical staff really didn't know anything about the mouth, to be honest. That was quite a big surprise. So my last practice I worked in was a private and NHS practice, and I was used to things getting done. And if we needed things, we ordered them and they arrived. In the NHS, things are a lot slower. In hospital, things don't happen quickly. So that was another big surprise. I couldn't get things done at the speed that I would normally get them done. You tend to have layers and layers and layers of management in the NHS hospital, and you have to climb your way through them to get what you want to do. So that was a surprise.
And I guess, to be a little bit cliche with it, it seems at least like it's a marathon, not a sprint, with hospital care for mouth care. So how do you plan your day? Because you can't plan like a 9-to-5 day like you maybe could do in a practice. I imagine that it's very different when you're in the hospital.
I don't know what I'm going to find in my day. So when I go in the morning, I check my emails in the office. I could have any number of referrals or inquiries. And it's about, my time is very limited. So it's about prioritising what I need to do on that day and the patients I need to have a look at. So I tend not to over-organise my day. Actually, I tend to go in and see what's happening. So I've got my set things that I need to do, my meetings I have to attend, my training I have to do, but in between then I'm seeing patients. I'm finding that I have to review them a couple of times. So most people that I see have quite complex needs and are in quite a poor state of oral health, and it's been going on for some time. So it's not a quick fix. I can't just go in and speak to the nurse and say, well, try this, try this, try this. It's actually, I've got to go back over a few days and see that there is an improvement. Mm-hmm. It's quite nice. You can go and catch them when they have visitors. So if their family are there, it's quite nice to engage them, talk about the patient's oral and dental history, and how they've been managing by themselves at home, or if they have carers and so on. Just getting the full picture of the patient.
Do you have any advice, not necessarily for people that are going into dentistry, but for maybe professionals or care staff that are working in the hospital settings or the care settings, as to what they can do to better improve oral health of their patients?
Well, in a care setting, we do now have a set of guidelines from NICE, which previously there weren't. So I would say those guidelines are quite good, quite detailed, and they do set out how a carer would look after their resident's mouth and what's required, basically. So now when somebody goes into a care home, there should be a set protocol for, have they got a dentist? Who is it? That kind of thing. Have they got dentures? And, about what their normal routine is with their mouth and so on. So that's a very good thing that we now have those nice guidelines. There is help everywhere. There is a lot of advice out there if professionals don't know what to do about certain problems. So Mouth Care Matters have masses of really good resources for hospitals and some care homes. So it's always worth Googling Mouth Care Matters and reading up on their resources, which are really, really good and are freely available to everyone. Oral Health Foundation, also lots of information there. It's just about finding the information. Not everyone has got access to an oral health practitioner, so they have to dig and find the information themselves. But there's so much really good advice out there, which is very nice.
Much like yourself and all the advice that you've given on this podcast. And, well, Anita, thank you so much for talking to me. I am going to let you go and get on with the rest of your day, as I know that you are a very busy person and I'm sure you've got lots to rush off to. But, yeah, thank you again for sitting and talking to me.
Oh, lovely. Thank you. It's been a pleasure.
Well, there you have it. That was Anita Stanforth giving a brilliant window into the day and the career of a oral health practitioner in the hospital service. If you'd like to know more about National Smile Month, our website is www.smilemonth.org. You can follow us on social media at Smile Month on Facebook and Twitter, and at Oral Health Foundation on Instagram. If you have any queries relating to your dental health and you want to speak to an impartial advisor, you can call our helpline on 01788 539 780, and one of our advisors will be really happy to help you. Thank you for listening, and I hope you enjoy the rest of National Smile Month.